Good afternoon, everyone, and welcome to the Forbes platform. Today we have with us Dr. Ketan Desai. Dr. Ketan Desai has done his MS surgery, DNB surgery, and MCH urology. He is a consultant urologist and laser specialist and a robotic urologist. He is an honorary urologist at Sir H.N. Reliance Foundation Hospital, Jaslok Hospital, Saifi Hospital, Bhatia General Hospital, and Wockhardt Hospital, Mumbai. Welcome to the platform, sir. Dr. Ketan Desai will be discussing today on the topic of kidney stones. Coming to our first question, what are kidney stones?
Kidney stones are formed from native urine. Kidney gets supplied by blood. The nephrons of kidney extract unwanted metabolites from blood and water into urine from blood, and that is excreted out. This urine is a very complex solution and it holds lots of insoluble and soluble salts in its liquid in a mixture form. But when the concentration of insoluble salts exceeds the capacity of the urine to hold them in soluble form, they tend to crystallize, and over time these crystals become larger and stick to each other and form stones.
What are the usual symptoms with which patients are presented to you?
Patients with kidney stones only, not in the ureter, not in the bladder, not in the urethra. The stones in the kidney can present in a varied way. It can present from being completely asymptomatic, and patient has come to know of the existence of these stones only on routine investigations, to the spectrum. The other end of the spectrum will be patient has got severe obstruction, severe fever, patient has gone in septicemia and has become hemodynamically unstable and has become a life-threatening situation. Between these two extremes, the commonest way a kidney stone can present is with pain in the back on the same side as the kidney which has the stone. That pain will radiate, it will start from the back, come in front, or go slightly lower down. It may be associated with nausea and vomiting. It may be associated with discoloration of urine in the form of pinkish or reddish urine. Patient may develop or complain of short rise of temperature or maybe fever with rigors. These are the commonest symptoms that a kidney stone can present with. First and foremost, a good clinical history and a good clinical examination. After that, the least I would do is a complete blood count, a urine routine. And depending on the symptoms, if I find from the symptoms that patient has got a ureteric stone, I will not do sonography. I will straight do investigations which is known as non-contrast CT KOB. It takes 2 minutes.
Yeah.
It's so fast. In a good machine, it's very fast. No injection required. 99% of patients with stones do not require CT with contrast. So they're very fast and it can be done without fasting. So patient comes to me at 4 o'clock in the afternoon. I can have the patient back in my clinic at 6:30 with the CT done, and I can take the decision whether he or she requires surgery or not. These are the commonest things. But if you do not doubt a ureteric stone, then maybe you can get away with a cheaper alternative of investigation in the form of a sonography.
How do the symptoms differ if the stones are in the ureter or lower down?
The ureter is a long tube, almost in a normal adult, ranging from 20 to 25 centimeter. Depending on, we as a urologist, we divide them into upper third, middle third, and lower third. The stone, depending on the patient, depending on the position of the stone in the upper third, middle third, or lower third, the symptoms vary. But more or less, it is similar to kidney stone in the form of pain, in the form of nausea, vomiting, in the form of discoloration of urine, in the form of fever. But the site of pain will differ according to the position of the stone. The pain in ureteric stone may start in front and go down. As the stone progresses down, the pain may go down over along the thigh or along from where the patient is passing urine. These are very, very symptoms. Based on symptomatology alone, a good clinician will be able to approximately say that where is the stone impacted in the ureter, in the upper third, middle third, or lower third. A ureteric stone management becomes more of an emergency than a kidney stone unless patient has fever, is because when the stone is in the kidney, the urine from the kidney is still coming down through a small tube, which is the ureter. But even a small stone, if it blocks that ureter, the damage to kidney is far more and far acute than what a kidney stone would cause damage to kidney.
How are these stones formed, sir?
I told you earlier, the stones are made up of insoluble salts, which are normal constituents of normal urine. The commonest being calcium. The salts of calcium which are found in kidney stones are calcium oxalate, calcium phosphate. Calcium oxalate is again of monohydrate and calcium oxalate dihydrate. These are very hard stones. You can have uric acid stones. You can have a combination of uric acid and calcium stones, or you can have a pure infective stones where there is no obstruction of urine, there is no stasis of urine anywhere in the system, and yet the stone forms. And these stones are called as infection stones. And these stones are because of a specific organism which splits urea, which is normally present in urine, precipitates insoluble salts, and the stone grows very fast. Most of these patients have very large stones and are completely oblivious of its presence.
Do diet regulations play a role in the prevention of stones?
In prevention, yes. We call them metaphylaxis. See, for diseases which can be prevented completely, we call them prophylaxis. Like most vaccines would prevent them almost completely, which is not so in kidney stones. So whatever you do, your aim is to decrease the rate of recurrence, and that's called metaphylaxis. Yes, certainly. Diet restrictions go a long way, especially if you're a predominantly non-vegetarian diet or if your stones are predominantly uric acid stones. What you have to do is, first thing is increase. Now, if you have a jar filled with water and you go on adding sugar, there'll be a time when no sugar can no longer be held as a solution and it will start precipitating as solid. You add more fluid to it and maybe that sugar also will dissolve. So first and the foremost is have adequate amount of water intake or fluid intake in any form, which ensures that you pass about 2.5 liters of urine in a day in a normal adult weighing above 60 kg. If you pass about 2.5 to 2.75 liters of urine in a day, preferably in a regular fashion, don't that you pass 1 liter in the morning, 1.5 in the night, and during the whole day you hardly drink any fluid. No. So have a regular intake of fluids, ensure a 2.5 to 2.75 liters of urine output, decrease extra intake of salt, don't have too spicy food, avoid organ meat in the form of brain, liver, and kidney, and avoid red meat. If you follow these, you will have a fair amount of metaphylaxis. I know there are lots of misnomers like don't eat seeded foods and don't eat seeded fruits and vegetables. They go into stomach, they don't directly go into kidney. Right. So it has to be assimilated in liver, have those salts. The salts have to be excreted in kidney. But if you have other features which can hold them in soluble form, you really won't worry. Unless you are having 10 kilos of tomato in a day. That's different. But if you're moderate, most of these can continue. There's no problem. And you can have very specific restrictions depending on very specific stones like cystine stones. There are certain drugs which you have to take for a long time. They themselves may form stones in urine because their metabolites get excreted and they form stones. There are certain stones which are completely hereditary and which are known as cystine stones. You know, they are very hard. There's patients that runs in families, and patients who have homozygous hypercystinuria will be short stature and they will have stones which go on recurring because they have extremely high excretion of cystine because they have a metabolic defect where cystine cannot be metabolized. So in there you require very specific drug prophylaxis.
Right.
And besides all this, we always tell them we have certain drugs which will decrease calcium and oxalate absorption from GI tract. We have certain natural solvents which are present in urine, like magnesium citrate, which we can give in the form of solution, which will hold or which will increase solubility of normally insoluble salts. So it's a multifaceted approach. But for a common man, the restriction or the metaphylactic steps which I told you should do well. The remaining are clinician, and he will customize it according to the patient.
What could be the treatment approaches for kidney or urethric stones?
Depending on the size of the stone and what is the presentation of the stone, of course, the first, just because I'm a surgeon doesn't mean I have to operate on every patient.
Exactly.
So first thing is, of course, I would like to conserve, but then there are certain, it's not only the size of the stone, what has that stone done to the kidney? What has that stone done to the patient as a whole? So you have to have a very holistic approach, and you have to explain to them that, okay, your stone is small, but the damage that it has caused to your kidney already is not worthwhile waiting. Or you can have a stone which may pass on, not much damage to the kidney, patient is well controlled on pain. When he stays nearby, can come and follow up with me anytime. If he stays in a small remote place in Maharashtra or other state where he does not have very good medical care available, there I would like to be a little more aggressive. But patients who can have fairly good amount of urological care nearby and does not have complications, fairly well controlled, has a stone which is about 4 millimeter size, yes, I would give them medicines, I would give them lots of fluids, and there is no fever, then I would wait for about a couple of weeks and see if the stone passes or not on its own. Fair number of them do pass the stone spontaneously, and we can save them surgery.
Apart from diet restrictions, any other lifestyle changes or recommendations that you would suggest?
Yeah. Besides the fluid restrictions that I have told you, I mean the fluid, not restrictions, excess amount of fluids. If you are having a workout, then the fluid that you consume during workout is in addition to what you consume to ensure good urine output. That is one. Otherwise, avoid excessive exposure to sun and have a healthy lifestyle, good vitamin intake, and have a diet which is fairly well balanced. I've had patients who are staunch non-vegetarians. They have to have red meat on every meal. Well, these patients tend to have very high recurrence of uric acid stones or calcium oxalate stones because their urine composition is completely different. So these are the only lifestyle changes I would say. Otherwise, per se, just maintain healthy lifestyle and a balanced diet. That should be good enough. You don't have direct relationship of lifestyle management to like you would have in a cardiac patient.
Thank you so much, sir, for this very interactive session. I'm sure the patients would really benefit from today's discussion. Thank you once again, sir, for being on the Forbes platform.